So breast lift, or mastopexy as it's also known in medical terms, is an operation where we're trying to lift the breast back up to a more favorable position. So a breast lift is needed in a couple of situations and for a couple of reasons. Either the skin has stretched and the breast has dropped, or the ligaments of the breast itself have elongated and so the breast has dropped further down on the chest wall. This may happen for genetic reasons. A lot of patients just have softer, looser skin, but it also may happen after breastfeeding, and that's probably the most common scenario. Now, the one thing we're never going to stop or never going to be able to get rid of on Earth is gravity, and that's the ultimate cause for a breast to toes or droop. And so ultimately we reposition both the nipple position and the breast tissue onto a higher position on the chest, where they will then continue to settle again in the future. But I think that more than just a breast lift, and thinking of a breast lift as elevating the tissue, I think that more and more as I've moved on in my career, I think of it as a resetting of the ratios of both the nipple position to where the breast sits and where the inframammary fold or the lower fold of the breast sits. And if you can reset those positions, you can actually give a much more favorable aesthetic result to the breast. I also have a couple of other tools available in my breast lift that I often use. One will be fat grafting. I think fat grafting to the upper pole of the breast is very, very useful in a mastopexy. The other thing that we may be able to use, and my preference is to do as a two-stage, is a mastopexy augmentation, where I then add a breast implant at the second stage after the breast has been lifted. And then a final option at my disposal is the use of internal mesh, which allows me to give extra added support in a patient who really is very focused on trying to get long-term longevity to their mastopexy. Some other things that I often tell a patient after their mastopexy is that bras should be used as much as possible. Now, everyone wants to have a scenario where they can go braless and that they never need to look at a bra again. But I think that ultimately, the more you support your skin and the more you support the result with long-term wearing of bras, and I mean crop tops when you're asleep and soft bras, structural bras in the daytime, the longer your result will last. Of course, there's moments, there's days, there's nights when you're wearing a strapless top or something like that where you can go without a bra. But over and above those scenarios, I think the more you support your outcome, the longer your outcome will last.